Well, in the past, in patients with breast cancer with early stage disease, approvals for adjuvant therapy of micrometastatic disease, have always been based on large adjuvant trials where patients are randomized to treatment A or treatment B. The problem with this approach is that these trials tend to be very, very large, very expensive, and take a very, very long time to give us an answer in terms of whether or not the patient is receiving clinical benefit. So the question has been, can we do a better job? And can we do something that will be cheaper, quicker, and still give us an answer that's useful in terms of improving the patient experience and hopefully improving the patient's length of life? And one approach that's been suggested is that we use preoperative or so-called neoadjuvant therapy to look at pathologic complete response rate. The idea being that if we're capable of eliminating all of the cancer cells in the breast and lymph nodes, then it's also likely that we're eliminating all of the cancer cells elsewhere in the body. And indeed, if you look at studies of patients who receive neoadjuvant chemotherapy, patients who have a pathologic complete response rate do pretty well. In fact, they do much, much better than patients who have significant residual disease for many types of breast cancer. So might we be able to do this? Might we be able to use PCR as a surrogate for long-term benefit, for disease-free and overall survival?